All right, so we're going to pick up where we left off in the lecture on pharmacodynamics and pharmacokinetics. This is actually the slide that we left off talking about drug plasma concentrations and what happens when you have too little of a drug in you and what happens when you have too much of a drug in you. And remember, the goal is when we're having our drugs in our system is for it to get to our blood plasma. So we're going to talk now about how our drug therapies actually move through our system and actually get to the plasma or other parts of the body. So that's where we're headed to next. And so this is essentially, how does it get into the body and affect plasma concentrations to actually give you a dose response or the effects of the drug? This is called pharmacokinetics. So we've got a lot of different ways that you can administer drugs, and you guys are pretty well aware of this as humans that have used drugs before. Your doctors may have prescribed it differently than others. So, for example, if your target is to get to the respiratory tract, your goal would be using an inhalation method, so our MDIs. You could use intradermal. This is going to be right underneath the skin in a hypodermic needle. Sub-Q goes right into subcutaneous fat. If you need to get it into the nasal passages, you would go intranasally. Intramuscular medications are often used in sports medicine because it can target musculoskeletal tissue more easily. Intraspinal goes right to the spinal cord. And then one of the most effective methods is an IV, and we'll talk about that. Orally is certainly the most common method. We'll talk about how it's actually not the most effective, but obviously it's going to be the easiest to administer in the lay population. Rectally would be something like a suppository that you might need to utilize. Sublingually would be the things that dissolve underneath the tongue. There are also external administrations that we use in sports medicine and also general medicine. Injections, ointments, paste, plasters, these are all things that are basically put on the skin that you might use onto the surface of the skin. Certainly if you're trying to target the dermis, that's great. But sometimes these transdermal administrations, like a patch, you can think of like a lot of different a lot of different birth control methods actually use a patch. So the medication just goes into the skin and then eventually gets to the plasma. We use Voltaren patches a lot, which is a powerful NSAID, so that we don't have to get the gut side effects of the NSAID. We use a patch instead, so we can talk about that. So this is something to really keep in mind. These are the 4 steps that a drug will always take once you administer the drug to your body. It will, number 1, be absorbed. Number 2, it will be distributed. Then it's going to be broken down and metabolized and eventually excreted. This is always the process that it's going to take. That sequence is really important. Okay. So the first thing is it absorbed. The route of administration will obviously affect how it and how quickly it is absorbed. So you think if you have a rectal administration, intestinal, by taking a pill, or dermal administration, that will affect how quickly and where it's absorbed first. Usually think about the desired route. If you want it to get to the skin, well, then use an external administration. If you want to get it to the respiratory tract, we'll use an inhalation administration. And the absorption of drug is dependent on the chemical characteristics of that drug. It's also dependent upon, if that person's taking it orally, the gastric emptying time of that individual. The drug vehicle is the inactive substance that transports the drug. So if you're doing an IV, there might not be a lot of inactive substance. But if you're taking a pill, there's going to be something sweet or a capsule or a coating to the pill that's inactive, and it really serves as a vehicle to get the inside contents of the drug into the body. The bioavailability is the fraction or percentage of that unchanged drug that actually reaches the plasma or the systemic circulation. So I have a good example here. If 100 grams of a drug is given and only 50 grams actually reaches the target, that means it has a bioavailability of what? And you guys would say 50%. Now, the bioavailability of the drug is dependent upon 2 things. Number 1, what route did you take? And number 2, the contents and chemical characteristics of that drug. And that will affect how that drug can cross through a membrane structure. So here on this chart, I have the routes of administration and then the bioavailability of that route of administration, and really sort of the characteristics of that. So with an IV, look at this. If you give an IV, if you give 100 grams of a drug through an IV, it has 100% bioavailability, so 100% of that drug gets to your plasma. That makes sense. You're injecting it right into the circulation, so that bioavailability makes sense. Intramuscular is next. This is going to be less, but very close to 100, and this is a really good feasible method as well. It's very painful, though. You know, just think about an intramuscular injection you may have had. It's going to be painful. Here's a sub-Q. This is less than 100, but it's still pretty powerful. Inhalation, you're getting to less than 100, okay? So anything below these are much less than 100. Inhalation, it's really rapid onset to the site, but it's not going to have 100% bioavailability. Oral is definitely not 100%. It is, however, very convenient, but we'll talk about how it's got a really high first pass effect, so it's broken down pretty quickly already in the GI tract. And then transdermal, this is slow, but it has a low first pass effect, so you might actually get more of the drug into the system. And what is this first pass effect? So in drug metabolism, when the concentration of a drug is greatly reduced before it gets to the circulation, that means it has a really high first pass effect. So if I take a drug in 100 milligrams and only 50 milligrams of that actually gets to my circulation, that has a high first pass effect. So when I actually swallow it, and this happens a lot when we take oral medication, it's actually going to get absorbed in the digestive system first, and then it goes through the portal vein into the liver, and then it reaches the systemic circulation. So a lot of it is actually broken down before it gets to the circulation. The other thing that affects the absorption is how quickly the pill's contents, their chemical makeup, can actually cross membranes. So, you know, there's 4 processes to get things across membrane structures and into the circulation. Passive diffusion, which is quick, active transport, which is pretty quick, facilitated diffusion, and endocytosis. Why that's happening, sorry. So, you know, you think about these, you know, diffusion is a non-energy expending, needs a gradient, but it can be really fast. Active transport requires ATP, and facilitate is a kind of a mixture of the both. And then endocytosis is invagination into a cell membrane. So it really depends on the chemical makeup, how quickly it can move across a barrier, but the quicker and more easily it can move across a barrier, the more readily it is absorbed. Okay, so that was number 1, how it gets absorbed. We're going to take a break here, and then we'll move on to the next 2, 3, 4 stages of pharmacokinetics.